Hi, my name is Sierra Brock, and I was an intern at SCG Orthopedics. Some of my responsibilities included breaking down patient charts every day, as well as breaking down surgical charts. I also sent faxes for the various doctors. I also followed them into the patient's rooms to learn about the orthopedic field, and I set up injections for the doctors when they were needed. I see patients every day that need a total knee replacement or have had a total knee replacement, and so I decided to conduct my research on the surgical procedure of a total knee replacement. Patients who need a total knee replacement have severe arthritis in their knees, and they have tried the more conservative methods such as injections or medications, and those have not worked. The first total knee replacement was performed in 1968, and since then the sterilization and the technique has been perfected. It is considered one of the most successful procedures in the medical field. And in the United States, about 600,000 total knee replacements are performed every year. A way to know if you need a total knee replacement, you have already tried the conservative measures such as medications, you've used walking supports, you've tried physical therapy, and you've also tried cortisone injections, and those have not worked. The second most conservative method before total knee replacement is called Orthovisc, and I learned about this. It's a series of 3 or 4 injections, one every week, and it's it's a naturally occurring lubricant found in a healthy knee joint, but it's created from a bacterial cell instead of like they used to take chicken comb and they took the lubricant out of that and injected in your knee, but now it's grown from bacterial cells. A total knee replacement can also be called a total knee arthroplasty, and an arthroplasty is a surgical procedure to restore the integrity and function of a joint. And a total knee replacement might be accurately termed a knee resurfacing because they take out all the damaged cartilage and bone and they put in a prosthetic in your knee. There are 4 basic steps to the surgical procedure. The first one is preparing the bone. So that is cutting off the edges of the tibia and the femur, which are the diseased portions. And there is also a small amount of the patella removed if your patella has damaged bone in it. The second step is positioning the metal implants. So the doctors, they take measurements, very precise measurements, and they put the metal insertion into the bone, and they move your knee around, and they manipulate it all kinds of ways during surgery while you're asleep to see if that prosthetic is the type that you should use. And then the third step is resurfacing the patella. As I said before, they resurface your kneecap, which is the patella, just in case it has damaged bone as well. And then they insert a spacer, which acts as your meniscus, and this just acts as a cushion between the metal part that goes on your femur and the metal part that goes on your tibia. This is a picture of before. This is before a total knee replacement. You can see all the damaged bone and all the bone spurs that have occurred, and then after, it's perfectly cleaned up, and this is the femoral component, and this is the tibial component. This is an actual picture of what goes in your knee. So you can see this is the femoral component, the tibia component, and then the spacer right here that acts as your meniscus. This is the anterior view, and this is the posterior view. This is an x-ray of before a total knee replacement. You can see there's hardly any joint space, which is arthritis when you're bone on bone. And this is after a total knee replacement. You can see the nice space there, and you can also tell the femoral component, the tibial component. So overall, total knee replacement is a very effective surgery, but it is also a very large surgery and takes a long amount of recovery time. But most patients who decide to have a total knee replacement, they're just so fed up with all the pain and limited activities they're able to do, they are ready to work hard to go through the surgery to get back to normal activities. Thank you.